We find ourselves in the midst of a diabetes and obesity epidemic. Everyone is looking for answers and ways to decrease the risk of developing diabetes. Researchers have determined that patients with both type 1 and type 2 diabetes consistently and significantly have lower levels of vitamin D when compared with the general population. In fact, studies are now showing us that if you have a vitamin D deficiency, you have over a 90% chance of developing prediabetes, and you actually double your risk of progressing to full-blown diabetes. The connection between vitamin D and diabetes is due to the large number of vitamin D receptors found in the beta cells of the pancreas, which are the insulin-producing cells in your body. There are also vitamin D receptors in your liver, fat, and muscle cells, which influence how effectively you handle glucose in your bloodstream. In other words, vitamin D is critical for the optimal handling of blood sugar within our body. This has led researchers to actually study what happens in patients who are pre-diabetic or those who are already diabetic when they begin supplementing their diet with optimal levels of vitamin D. A study reported in the August 2011 issue of the American Journal of Clinical Nutrition followed a large group of patients who were pre-diabetic. They either received 2,000 IUs of vitamin D or a placebo. Those who supplemented with vitamin D had significantly improved glucose clearance from their blood, improved insulin secretion from their pancreas, and a trend to lower the amount of sugar in their red blood cells called a hemoglobin A1C. The control group saw worsening of all these parameters. These researchers concluded that supplementing 2,000 IU of vitamin D in patients who were pre-diabetic significantly slowed and even prevented the progression from prediabetes to diabetes. Another study reported in the April 2011 issue of the American Journal of Clinical Nutrition demonstrated the fact that supplementing even with 1,000 IU in patients who were already diabetic received significant health benefits. These researchers documented significant decreases in fasting blood sugar, improved hemoglobin A1C, improved insulin resistance, and waist circumference and body mass index when compared to those control diabetics who received just a placebo. Other studies that supplemented vitamin D3 in diabetic patients observed that these individuals had reduced blood pressure, had reduced total cholesterol and LDL or bad cholesterol, and protein levels in their urine, all of which are risk factors for heart and kidney disease in diabetics. With very few exceptions, doses of vitamin D3 less than 1,200 IU daily have not been shown to be as effective as doses greater than 2,000 IU daily in demonstrating these health benefits in both pre-diabetic and diabetic patients. This is why I will continue to recommend that all my patients supplement their diet with somewhere between 2,000 IU and 4,000 IU of vitamin D3 daily, which is the most potent form of vitamin D supplements.